Have you ever wondered if your size is normal? Maybe you've caught yourself comparing to what you've seen in movies or online, and felt a little insecure. If so, you're not alone. In fact, studies show that over half of men are dissatisfied with their size, even though the vast majority actually fall within the normal range. The real surprise? While men may worry, their partners usually don't. Research consistently shows that around 85% of women are happy with their partner's size. So why is there such a big disconnect between how men see themselves and how others see them? Today we're going to uncover the truth about penis size. We'll explore what science really says, where our insecurities come from, and what medical experts recommend when it comes to treatments and procedures. By the end, you'll have the clarity and reassurance you need, without falling for harmful myths or dangerous quick fixes. Let's start with what the research shows. The average erect penis length is about 13.2 centimeters, or just over 5 inches. That's the global average, based on thousands of measurements in scientific studies. Anything significantly smaller than 2.9 inches, when erect, falls into the category of what's called a micropenis. But here's the thing, it's extremely rare, affecting only about 0.14% of men worldwide. Most men, even those who constantly worry, fall comfortably into the normal range. The real issue isn't size, it's perception. Many men struggle with something known as small penis anxiety. It's a form of body dysmorphic disorder, where a man becomes consumed by the belief that his size isn't enough, even when it's perfectly normal. This type of anxiety can be incredibly damaging. Studies show men may spend more than an hour a day obsessing over their appearance. For some, it goes further, affecting relationships, mental health, and even leading to depression or suicidal thoughts. It's not just a physical concern, it's a deeply emotional one. Much of this insecurity comes from comparing ourselves to unrealistic portrayals. Pornography has shaped how many men and women view size. But what we see on screen isn't real biology, it's performance. Actors are often chosen specifically for larger than average sizes, and what's presented is exaggerated and distorted. When men compare themselves to these unrealistic standards, they lose perspective. What's completely normal can start to feel inadequate. And this sets up a cycle of anxiety, shame, and constant searching for solutions. And that brings us to the next big issue: the so-called solutions you find online. When you search the internet for penis enlargement, you're bombarded with ads, supplements, injections, surgeries, and unlicensed treatments. Many of these are dangerous, unproven, and in some cases permanently harmful. Men travel abroad for cheap procedures, only to end up with devastating complications. The Sexual Medicine Society of North America has made their stance very clear. Enlargement procedures are not recommended unless a man has a documented micropenis. That's because almost all available options are either experimental, carry major risks, or provide only minimal results. But let's break them down carefully so you know what's out there, and what science actually says. Non-surgical approaches are often the first to be explored, and the most important one is psychological counseling. This may not sound like a treatment, but in many cases, it's the most powerful. Counseling helps men see what's normal, reduce anxiety, and rebuild confidence. In fact, research shows that when men with size anxiety undergo counseling, most no longer feel the need for medical procedures at all. That's how effective it can be. Next, penile extenders. These are traction devices that apply gentle stretching over long periods of time. Clinical studies have shown they can increase length slightly, usually around 2 centimeters, when used consistently for several hours a day over many months. However, the gains are modest, and the process requires discipline and patience. Side effects like numbness, bruising, and discomfort are common. Then there are vacuum erection devices. These pumps are sometimes advertised for enlargement, but that's misleading. They're effective for treating erectile dysfunction by drawing blood into the penis, but they do not provide lasting increases in size. And then we come to injections. Here's where things become risky. Over the years, doctors and unlicensed providers alike have experimented with injecting substances into the penis, ranging from fillers to silicone. The results? Poor outcomes, serious complications, and long-term damage. Scar tissue, deformity, and erectile dysfunction are not uncommon. Experts strongly advise against any form of injection therapy for enlargement. Now let's discuss surgeries. The most common procedure is called suspensory ligament release. Surgeons cut the ligament that anchors the penis to the pubic bone, allowing it to hang lower and appear longer. While this can create a visual change, it doesn't actually increase the functional length of the penis. Risks include scarring, instability, and loss of angle during erections. Other surgical attempts include the use of skin flaps, grafts, or even rib cartilage to try to lengthen or thicken the penis. But outcomes are poor, satisfaction is low, and complications are high. Importantly, most of these surgeries have never been properly studied in large clinical trials. That means we don't have reliable long-term safety data. As of now, no surgical method is recommended outside of carefully monitored clinical trials. So where does that leave us? The truth is, there isn't a safe, reliable way to dramatically change the size you were born with. Penile extenders may offer small gains, but they require time, consistency, and come with risks. Injections and surgeries? The dangers far outweigh the potential benefits. What works, and what matters most, is addressing the psychological side of the equation. Understanding that your size is likely normal. Realizing that your partner is probably far more satisfied than you think. And learning to shift the focus from size to function, intimacy, and confidence. Because sexual health is about so much more than centimeters or inches. It's about how you feel about yourself, how connected you are to your partner, and how you take care of your mental and physical well-being. If you found this discussion helpful so far, take a quick moment to support this channel by subscribing. Here on The Healthy Body, we share science-based health advice that helps both men and women live fuller, healthier, and more confident lives. So next time you catch yourself worrying about size, remember this. Most of what you see online is an illusion. The reality is that the vast majority of men are perfectly normal. Treatments that promise dramatic results are either ineffective, dangerous, or both. And the single most powerful step you can take is to focus on your confidence, your mental well-being, and your relationship. Because confidence, not size, is what truly matters in the bedroom and beyond. Thank you for staying with me through this important discussion. If you'd like to keep learning about health, intimacy, and self-confidence, make sure to subscribe to The Healthy Body. I'm Dr. Alex, and I'll see you in the next video. And remember, your worth has never been measured in inches.